Unfortunately, the connection is acting up. I apologize to all the viewers. I'm really sorry. You know how the connection goes here sometimes. So what I'm going to do right now, and I think that this is something that we should be doing going forward, because as you've been following our page, you've been seeing us posting various type of information regarding the COVID. Can be information related to prevention. It can be information relayed from the government and other authorities, and our own personal prevention advices and things like that that we gather from reliable and verified sources also. But as we're going and having more and more followers on our page, I think it's about time that we start going live and engaging with the people, with our followers, and discussing this COVID issue, because it's really becoming extremely problematic in our country. And I think that it requires to really engage, even if not face to face, because that is something that is becoming almost impossible nowadays to do and not even recommended. But virtually, there's a lot we can do to be able to spread the word of advice, engage in meaningful conversation, all that with the intention to really curb the spread of the COVID-19 in our country. We are all aware that the situation is quite alarming right now. There's lots and lots of information going around, and in the middle of all those information, there are also false information. There are also rumors, and rumors can easily create a chaos. So it's very important to have a platform, a reliable platform that will be dispatching, that will be airing and giving factual, verified information, and where people know that they can safely log in and listen and will only get reliable information. So this is what we intend to do going forward. We intend to really be sharing whichever information that we have verified and confirmed with you, with the hope that you will also be relaying to your families, your relatives, your friends, and immediate surrounding, whether here or abroad, with the hope that those information are going to be beneficial to the recipients. Okay. So we will quickly do a review of the figures that we've received yesterday, the 3rd of August, regarding the latest figures that we've received, because so far we've not yet received the latest updates regarding the latest figures. So we can only go by with what we've received as of yesterday. So as of yesterday, the new cases that had been announced by the health ministry was 173 cases. There was 173 new cases that had been announced by the health ministry yesterday, of which the total death that had been announced as of yesterday again was 14. A number of 14 deaths was registered in total as of yesterday. The total number of confirmed cases was of 671 as of yesterday again, of which 79, a total of 79 recoveries, okay, which makes it like a total of 572 active cases. So out of these 671 cases that have been registered since the beginning of the pandemic, it seems as if the active cases, meaning that the people who are still carrying the virus within them and that are still dealing with the virus is active in their system. There's a number of 572 people so far, okay? So when it comes to the quarantine, the figures reveal that there's 529 people still on quarantine as of the 3rd of August 2020. The total number of people on quarantine is 529. Okay, so these are the latest figures that we got as of yesterday, and we're still waiting for the updated figures that might be coming up probably tonight or hopefully tomorrow. We do not know, but as we receive them, we will be reporting them. That's how we've been doing it since the beginning. What more? As regarding the news coming out from the focal point of the COVID-19 strategic communication, the information officer, which is Prince Boubacar Sankano, it seems as if the president should be addressing the nation shortly. This is what we understand, but we still do not know when exactly, if it's going to be today, if it's going to be tomorrow, we have no idea. But this is what has been reported from Prince Boubacar Sankano's page earlier today. Okay, so we are waiting because I know that this is something that the general public has really been requesting for, and it is long overdue. People are really calling for the president to come out live and address the nation, talk to his people as the highest authority of the country, to address the Gambian people during these difficult times that we are faced with, and to reassure and also let the population know what is the plan of action going forward, because it is clear that things are getting a bit out of hand according to the reports that are coming out from the ground. So all we know is that the Red Cross is doing an amazing job, a very, very difficult job, as a matter of fact. We know that the Red Cross is involved in collecting the dead corpses and organizing the barriers according to safety and security measures always. And this is a job that is extremely, extremely sensitive. And I think they need to get recognition for what they are doing. They're putting their life on the line, and this is something that they need to be acknowledged for. Regarding the 1025 number, that's also another issue, because we've been having on our COVID Gambia page lots of people contacting us, telling us that they've been trying to get through the 1025 numbers, which is the helpline that the authorities have put forward for anybody facing COVID-19 symptoms or having some health concern, some serious health concern, and needing some advices. The 1025 is the helpline to call. So people have been contacting us over the weekend and even a bit before to tell us that they're facing difficulties in reaching the 1025 helpline, that there is either no answer or the line is down. So it was a bit complicated. So they reached out to us by messages or by text messages via the phone number that is provided on our page, telling us that they wouldn't want to know what to do. As we make it clear to everybody all the time, we are no health authority and we have no mandate to advise on health issues. This is not our role, this is not our responsibility, and this is not even, we do not even have the capacity, as a matter of fact. So what we do, whenever we receive a message coming from the public, we will share with the authorities immediately, and then they will take it into account and do what they need to do on their side. We are just communication and IT professionals, and that's all we can do to help, you know. So yeah, and I saw Lamin Jai of the Health Ministry on Kerfatu yesterday mentioning this issue of 1025. It seems as if that line was down due to some issues, and that it is now resolved. And they've also come up with additional helpline numbers that the public can call in case of emergency or in case of need of certain type of advices if anybody is facing the some COVID-19 symptoms. Okay, so this is what you can do. Keep on trying the 1025 number or the numbers that have been provided by the Health Ministry. Okay. We are also aware of, as per information coming from the ground also, and I'm sure that this is information that everybody is privy of. This is no secret information whatsoever. We are aware that reports are coming up about the mortuaries being full to capacity because of dead bodies that keep on arriving. Okay. We also got the information that hospitals have also reached their capacities, which is a big concern to the population, because people are asking, then what do we do in this case? Or if something happened to us, where do we go? We are aware of some private clinics having been infested with COVID-19 and as a result had to close down either temporarily or permanently. We do not know clearly, but those are the type of information that have come up. And it's also a big concern to the general public, knowing that in case of anything, these are the places where the general public rush to get some health care. So if those places are inaccessible, what is the solution? So those are the valuable questions that keep on coming up and that we keep on receiving on our platform. And obviously, we do not have the answer because, once again, we are not health professionals, unfortunately. But be sure that any information or any question that comes via our platform that we receive on our COVID Gambia platform, via the messages or via the telephone number that we've indicated on our page, any question or information is immediately transferred to the right authority, to the relevant authority that takes it into account and takes it forward, okay? So let me see the notes that I read there, because there's so many things to talk about and I don't think that we can talk about everything. This is the first live that we've launched. We've attempted for the few people who have tried to access it a couple of days ago. We've tried, but there was some little bit of issues with the sound, so we had to put it off. And we are back live tonight to try and do a little brief on the COVID-19 situation as per the information that we've been receiving or the information that we've seen circulating around, okay? As you've all seen, I guess most people have seen the press release that came out earlier this afternoon about the health ministry, Dr. Madulamin Samate, who is actually on quarantine following his interaction with some COVID positive people, and he would be operating from his quarantine place, which is a big concern again to the general, to people in general, because the health ministry, as we all know, is a very crucial person in the handling this crisis. So it's a bit complicated and a bit worrying if we hear that the health minister himself might be positive. There is no report as to him being positive so far, but the fact that he has gone on quarantine is a bit worrying also. So we hope to hear from the President of the Republic very soon, so that he can enlighten the population on how things will be handled going forward, because with all these difficulties added to that, the other ministers that we've heard about these past couple of days being tested, who had been tested positive, I'm sure that the government will find it difficult to run to its full capacity, and normally with all these things happening. We have also seen a press release coming from the KMC regarding the Lord Mayor Talib Bensouda, who also released, after the press release, a video also got released where he was mentioning the fact that he has also tested positive, but thank God, thankfully, he's on the verge of recovery at the moment. But the fact that he came out to also share his experience of the symptoms that he had been feeling all those days, and the words of advice, I think that is to be taken very seriously by the general public. People should really listen to those who come forward, because it takes lots of courage to come forward and mention the different symptoms or the personal experience that people have encountered dealing with the COVID-19. So the Lord Mayor's video is also online. It's gone viral. It's all over the place. I watched it a couple of hours ago, and I felt that it was very courageous and very good of him to actually come forward as the authority that he represents is also very important in the country, and he cannot afford to just be quiet about something of this magnitude. And I'm sure that his advices and his experience will be beneficial to many people. Yes. So What more to say? Let me go through my notes. Yeah. I guess, yes. I mean, if I should say more, I should have added Modunjai on this live, but because I'm not an expert on live, I find it difficult to even find the tab where to add. Let me just plug my phone to find the tab where I should add my colleague Modunjai, and Manyinya Danbel should also be on this live with me. Let me try and see. Maybe I can add them. Yeah, it's complicated for me because I'm using a computer that I don't usually use for these lives. So I'm not finding the right tab at the moment to be able to add them so that they could possibly contribute to this live video. Okay, so I mean, generally, what we have to say regarding this COVID situation, it's really worrying at the moment. I think people should just calm down and try to just adhere to the rules and regulation and recommendation given by the health ministry and the other authorities, competent authorities regarding the fight of this pandemic. I think the basic advices that we are hearing from the beginning is avoid social gatherings, apply social distancing, wash your hands, you know, wear a face mask, when in public, wear a face mask when you join public transports. Do not remove your face mask when you go past the police checkpoint. This is not about the police, this is about your own life. This is about the life of your families. This is about the life of your friends and all the people that you come across along the way. So we should individually be very responsible because the virus does not make any distinction between nationality, between race, between age, between whatever. You name it. The virus is a virus. It's viral. It's going all over the place. You have to be protecting yourself to be able to protect others also. And then whichever good information you get, whichever relevant information you get regarding the prevention against this virus, make sure that you let others know. It is true that lots of people do not believe of the existence of this virus. It's nothing to worry about. We should still insist on trying to enlighten them about the reality of this virus. There are different experiences that are here to share with people. And I guess a life that you save by sharing a valuable information means a lot. It means a whole lot. So do not relent in trying to advise and in trying to share valuable advices with your entourage, with your friends, families, relatives, you name it, okay? And one thing that people should really be mindful about is to spread wrong information regarding the COVID. In times of a pandemic or in times of a crisis, the killer might not even be the disease, it might be the misinformation. So let's make sure that we are extremely responsible in this case, that we stay at home as much as possible, as much as possible. Let's stay at home as much as possible until we understand the situation, because right now information is scattered. We do not know exactly what is going on, the magnitude of the situation, but we know that there is something extremely wrong going on, extremely dangerous going around. So let's not take it lightly. Let's be careful. Let's advise our people, and let's not spread any information that is not confirmed and verified. Okay? On that note, I thank you all for watching this live video, and I promise that we will be back with more information as we receive information. We will be sharing with you and also posting on our page. One more thing that I should add also, we have opened a mass production center in Serekunda, the former Aja Mari Cinema. We're employing about 20 young people who are tailors. They are trained tailors, and they are producing face masks on daily basis. We have a capacity of production of at least 1,000 masks a day, or you name it. So if you need face masks, you need to know that there's a place where you can get masks in quantity, which is the former Asia Mari Cinema. Okay, it's now been transformed into a sort of production center for masks. So we produce masks with logos, without logos of your companies or your organization. It depends what you need, but you need to know that masks are available there. And now that masks have been made mandatory, this is a way to really engage young people and help them earn an income. The reason why we started it as a humanitarian action, and then we've been distributing across the country through our partners, which is the Red Cross, okay? But to render the initiative sustainable, we now need to go commercial to be able to sell, generate an income, pay the tailors so that they can sustain themselves. This is what we are doing right now. So if you need to buy 500, 100,000, 2,000 masks, just contact us. We have the capacity to provide that for you, okay? So we thank you so much for watching, and I hope that at least you learned a thing or two. And we will be back again with more information as we receive them. Thank you.